Hi, I'm Dr. Meg. This is Dr. Carroll from Oasis Wellness Partners in Scarborough, Maine. Welcome back. Today we're going to walk you through different stretches that you can do when you have low back pain that is flaring up and is in acute situation. And not cute as in like charming, it's acute, like it's really yelling at you. So it's a series of stretches that are going to be beneficial to help your body adapt to what you're experiencing. The key thing with any of this is to make sure before you do it that you check with your own chiropractor, your own massage therapist, and just check in, make sure that they are kosher for you. Know that you need to listen to your body. Sometimes when a low back is really flared up, no stretching works at all for the first 24 to 48 hours. If you go try to do these, there's any pain at all, you need to stop immediately. So really make sure that you're testing and going gently with them in the beginning so that you're not going to do any harm.
The first one we want to go over, some people call it COBRA, and one of the things to recognize about all of these stretches is think about your day-to-day processes. And if you are a sitter in your job, in your life, and you're just contracted, the top of the body is contracted on the lower body in what we call flexion, in these stretches you just basically want to think about doing the opposite. You know, the body's meant to be balanced, as we talk about quite a bit. So COBRA, think about a snake. So COBRA is about extending, taking your body out of this flexed position and allowing it to lengthen and extend in the opposite direction. So you're lengthening the front body and shortening the muscles of the back body. Gently lift, as Dr. Meg just said again, we are not pushing into the pain, we're not trying to break it open, we are lifting our body with a gentle breath. That's another really critical piece for all of these, is to make sure you have movement of air when you do these. Don't hold your breath. Let it be moving through a gentle lips so that you're not pursed either. You're not blowing hard, you're just letting it flow. So again, lifting up and allowing the back to come up, and just a little bit at a time until you feel lengthening and extension, opening of your back. And then down and relax, and do it a few times until you feel a nice stretch from the pelvis all the way up to the top of the head and an opening in the front body.
The next stretch is a very simple. As you're laying on your back, you are simply extending both of your legs straight out, bringing one knee up to your chest, taking 2 or 3 good deep breaths in and out, and then switching, doing the opposite on the other leg.
One of the parts of the body that we want to release with something like this going on is something called your hamstring, which is the muscle that allows you to stay standing or staying erect. And it's the back of the leg from your buttock all the way to your knee. And I like to tell people to do this one either on your back or with a gentle upper body leaning up and forward with your leg up on something. But the lower, doing it on your back, I think when you're having a lower back issue or tension, is really the best. It's the most peaceful position for the discs. So what I like to do too is take a strap, if you have a yoga strap, or if you possibly don't have that, you might have a long beach towel you could use, or a strap off of someone's bathrobe would work. So you're going to take that strap and you're going to put it underneath the arch of your foot. You're going to be laying on your back. You're going to put it under the arch of your foot and just gently raise the leg, gentle, gentle. And keep your knee bent just a tiny bit at first, especially if the pain is pretty intense.
The next one is called a figure 4. This can be done in several different varieties. You can do it standing, and essentially you're making the figure 4 with your legs. So you're taking the ankle of one leg and putting on top of, above the knee of the opposite leg. So if you can do it standing, you support yourself and basically just squat down as far as you're comfortable going, making sure that you're breathing. You can also do this on your back, which again, as Carol described with the hamstring stretch, is the most easeful for your body in that condition typically. So you're going to be doing the same thing with your legs extended. Bring your left ankle up onto the top of the right knee, then you bend the right knee, grab behind it, and pull very, very gently towards you with your head flat, not with your head up. You don't want any contraction of the muscles in your neck. And then doing the opposite on the other side.
All right, and then we have a seated twist. This one I really encourage everyone to make sure you're gentle with it, as we've been discussing, and that you lift. It's important to lift those discs open and those joints open before you twist and try to bring an opening for this one. Again, your neck and lower back angles similarly, so make sure your head is up and relaxed, and then use your breath when you basically stabilize your pelvis and then gently turn the body in an upward and a rotational position, breathing gently and both definitely go to both sides. And as we said in the very beginning, if there's any pain with this, don't complete it. Just stop right there.
The final one is a pelvic tilt. You're laying flat on your back, your neck is relaxed, your head is flat, and your knees are bent. And you're essentially just trying to flatten the lower curve of your back to the floor. And it's okay if it doesn't touch. That's the movement you want to create, is that flattening of that curve. And, you know, with your breath, as easeful as it feels. If you can also lift up into a bridge, which is essentially lifting your hips up into the air. When the low back is really acute, this is not going to be a good idea. It's going to be later as your body is feeling stronger and feeling more pliable and feeling like your body's ready for something like that. So starting with the pelvic tilt in the beginning is really the key.
So thank you so much for listening, and we will see you very soon.